What is the obstacle we are trying to address with this project? Well, COPD is a life-limiting condition with no cure, and it is associated with a high symptom burden, leading to a poor quality of life in these patients. And the symptom burden, like severe breathlessness, pain, fatigue, depression, anxiety. Also, the COPD is associated with multiple comorbidities like cardiovascular diseases, lung cancer, osteoporosis. So the quality of life is poor, and so for these patients palliative care is indicated. COPD is responsible, when we look worldwide, for 2.9 million deaths per year, and with that it's the third leading cause of death. Patients with COPD are in need of timely integration of palliative care into their usual respiratory care. However, many people with COPD in Europe do not have access to appropriate palliative care. Most patients do not have access, be it some have access at the last week, for instance, in their disease trajectory at the end of life, but that is it. So there is no real access to palliative care, and this is what this project aims to do: integrate systematically this palliative care option in the treatment of COPD. And how are we going to do this? Well, we are going to use the novel, innovative iClear EU model. This is a model or an approach to effectively integrate palliative care into the treatment of COPD. And it is developed in the UK by Paul Marsden and the University of Lancaster. And it consists of several elements. For instance, an important element is to identify first the palliative care needs in these patients. Secondly, this is the I, identification. Secondly, you have the C of communication in weekly meetings with a palliative care specialist to develop care plans or management plans for these patients. Thirdly, in these meetings also the future care strategies and level of escalation will be determined. That is the LE, so you have I, C, LE, and then you have the A, advanced care planning with the patient, because of course all these plans have to be discussed with the patients and should align with their wishes and preferences. And finally, you have the R of ongoing review of these plans with home care. And so this is the model that we will integrate, that will make the integration possible of palliative care into the treatment of COPD. The iClear model, the novel iClear model, will be adapted for the different countries and will be then implemented and tested in 18 hospitals in 6 countries. And we will test the effectiveness of this model, of this integration, on the quality of life of patients, but also on the number of unwanted hospitalizations, which we hope that will be reduced. Also, the cost effectiveness of the model will be tested, and we will also look at the effect on the implementation processes. What are the benefits of this project? Well, the project aims to improve quality of life of the COPD patients and their families by reducing the heavy symptom burden, by reducing unnecessary hospitalizations. So this is a very important benefit. There are also other benefits. Another benefit is that it will enhance communication between patients, healthcare providers and their families, so that the care plans that are developed for these patients, the management plans, will align with patients' preferences and wishes. There are still other benefits. The intervention has the potential to be cost effective due to a reduction of hospitalizations, for instance. And finally, what we want to achieve is a model that is effective, but also feasible, acceptable, compatible, and culturally sensitive, so that we can finally implement it in all hospital settings in Europe.